All right, Joe, good advice. Thanks so much. In other news now, West Virginia is reporting 3 more COVID-related deaths this evening. A 49-year-old woman from Ohio County, a 59-year-old man, and an 85-year-old man from Logan County have died, bringing the number of deaths in the Mountain State to 115. So how do you explain something like this to children and help them cope? Well, some parents say they're seeing a negative change in their kids' behavior, and doctors are seeing an increase in patients. 13 News reporter Mariah Davis explains.
With COVID-19 shutting down lots of activities, experts say many children have reached their breaking points after being cooped up in the house for long periods of time.
Certainly caused them to act out more and definitely be more defiant than they would have otherwise normally been.
Child psychiatrist Dr. Hillary Porter says the defiant behavior includes children fighting and arguing with their parents and siblings. Some children are also showing increased anxiety levels and depression.
Honestly, just depends too on the day. If, like for right now, it's raining, some of my kids won't do as well. If it's not raining and they can actually at least get outside and play or jump on the trampoline or go swimming, the day will be a little bit better.
To give parents and children some relief, congressional Democrats are ready to spend billions of dollars to support child care. The House debated 2 bills on Wednesday. The first gives billions of dollars to child care providers to keep their doors open, and the second allows parents to take advantage of tax credits to offset the cost of child care.
My hope is that this would be folded into a COVID relief recovery bill.
If child care centers stay open, this would put children back on a routine, which Dr. Porter says is important.
The structure and the predictability of a good routine is actually very reassuring. They know what's going to happen. They don't have to kind of worry about what's coming up.
Porter believes parents should limit how much kids see on the news and take the time to really listen to their children, which will help calm their nerves.
So if there is the possibility of allowing kids to have a bit of a choice in things or allowing them to at least have a sense of a little bit of control, sometimes that helps decrease anxiety.
Reporting in Charleston, Mariah Davis, 13 News, working for you.
And Dr. Porter says as much as parents try to focus on kids, they also need to take some time for themselves to relax and recharge.